Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab. All on your time, live or on demand. This is CSIS Online.
Good morning. My name is Jake Kurtzer. I'm the Interim Director of the Humanitarian Agenda at CSIS. On behalf of CSIS and the Americas program, I welcome everyone joining us. Today's event focuses on the humanitarian situation in Venezuela. The UN's Office for the Coordination of Humanitarian Affairs estimates 7 million Venezuelans are in need of assistance, requiring over $750 million of external humanitarian aid. Prior to the onset of COVID-19, hyperinflation had decimated the purchasing power of the Venezuelan bolivar, contributing to high levels of displacement. Hunger and malnutrition are on the rise, and the domestic capacity to address these needs is limited. While confirmed cases of COVID-19 exceed 60,000, the lack of testing capacity and adequate healthcare resources within Venezuela draw into question that data and inhibit our understanding of the extent to which the virus has spread. New daily infections continue to climb, and Venezuelans returning from neighboring countries are being persecuted as vectors of the virus by the Maduro authorities. To unpack these issues and talk through some of these solutions, I'd like to introduce our moderator and panelists. Moises Rendon is the director of the CSIS's Future of Venezuela initiative and a fellow with the America program. Moises has spearheaded CSIS's scholarship on the crisis in Venezuela and has conducted extensive research on adapting US policy to address the humanitarian needs. We're honored to have him moderate today's conversation. We're joined by Feliciano Reina, founder and executive president for Acción Solidaria, which is dedicated to combating HIV and AIDS in Venezuela. In addition to his work with Acción Solidaria, Reina served as president of Sinergia, the Venezuelan Association of Civil Society Organizations, from 2005 to 2012. In March 2010, he also became a founding member of Civilis Human Rights, which is dedicated to accurately informing on the state of democracy and human rights in Venezuela. We're also grateful to be joined by Susana Raffaelli, a humanitarian expert and advisor to Caritas Venezuela on nutrition, food security, and natural disaster risk. In her past, Susana has also worked with UNICEF, the Red Cross, Oxfam, and Action Against Hunger, among others. Before I turn it over to Moises, I'd like to remind everyone that this video we're broadcasting live, and you can submit questions during discussion to the moderator using the Q&A function. We'll post the event in its entirety about 24 hours after we conclude. And with that, I'll turn it over to Moises. Over to you, Moises.
Awesome. Thank you, Jake. And thank you, everybody who is joining this morning live and for those who are watching this video later today. In today's event, as Jake mentioned, we want to shed light on the gravity of the situation on the ground in Venezuela and how the COVID-19 pandemic has further deepened the humanitarian crisis. I mean, hospitals in Venezuela are reportedly deadly surges in COVID-19, and the situation will only get worse as the economic, political, and social crisis also get worse, right? And as Jake mentioned, there are over 60,000 COVID-19 confirmed cases, but this number, according to other sources, are underreported, right? I mean, we expect that at least 60% more of those cases are contagion with COVID-19 too. So the number may only go up in the next few days and weeks. The other issue we will tackle today, and I talked to Feliciano a little bit before the event, is the fact that many doctor professionals are dying due to COVID-19. And as you all know, this is an important phenomenon because many doctor professionals have already fled the country. So the ones that are left in the country are dying at a breakneck speed. And that's an issue for the health system, which is already in shambles, right? And we also going to talk about COVID released a very important data in the last few weeks and months, and we're going to shed light on how this COVID-19 pandemic has put pressure on the education system, on the health, on the humanitarian field, and so on. And then lastly, Feliciano and Susana will help us understand what is the role of the US and the international community to continue helping Venezuela and to increase that assistance that is much needed. Just for you to know, Susana Rafali unfortunately is having a little bit of internet difficulties. She's on the ground in Venezuela, and as you all know, the internet connection there can be bad sometimes. So she hopefully will join us in a few minutes during the discussion. But for now, we have Feliciano. Feliciano, thank you so much for taking the time and for joining us today. As Jake mentioned, he's the president of Acción Solidaria and the founder or president of Acción Solidaria, which is one of the most important NGOs working on AIDS and the humanitarian field. Feliciano, thank you. Back to you.
Thank you very much, Moises. I'm very glad to be here from Venezuela as well. So I do hope that my internet connection works well through the whole event. So if we may start, thank you. We should start. I think it's always important. Let's start with the complex humanitarian emergency, the first slide, please, because I think it makes sense to return to where we were before we were hit by the pandemic. My very first, if we can go back, please, to the first slides, I would appreciate it. More. Thank you. Because I think it makes sense to speak about, again, where we're coming from. We have not arrived at the situation of the pandemic, you know, as perhaps many other countries with some sort of conditions to have the population face the effects of the pandemic. Venezuela comes from a context, a very difficult context, which we started seeing in 2016. Since 2016, years of progressive dismantling of the rule of law, lack of access to justice, great corruption, and political violence caused a devastating fall in Venezuela's economic capacities and the protection of social, cultural, and environmental rights, generating what is internationally known as a complex humanitarian emergency, a man-made disaster of great dimensions. The humanitarian emergency has caused deprivations on the rights to health, to food, education, livelihoods, and access to basic services, such as water and electricity. In some, it is a situation of widespread human insecurity, which also brought millions to flee in order to survive. I'll start with I will just only refer to two aspects. It's food insecurity and health insecurity. In regards to food insecurity, I'd like to, point out to the contents of the 2020 Global Report on Food Crisis. Can we look at the next one, please? And I think even though at the time, and this is the number, the next slide, please. This is the number that everyone has been talking about, the 9.3 million in acutely food insecurity situation. But to me, this is a report of a study on the ground between July and September of last year. The number to me that we have to look at is also at the bottom, which is the 17 million plus, which at the time were already marginally food insecure. And as they say in this report, the next slide, please. And I think this is really important because it means then that the 9.3 plus the 17 million would mean some 90% of the population. If you look here at what they say is that 60%, these households were in danger at the time, again, September of 2019, of becoming food insecure if they faced any additional shocks. So we're talking now about the situation of COVID-19 and the coronavirus, which was completely out of sight at the time. And this is also one of the huge challenges that we're facing now, in which one should think that in a pragmatic way, the way to face coronavirus has been not to have strict lockdowns, because people live on a day-to-day basis. They really need to go out to make the smallest living possible when the minimum wage is below $4. And even with some of these bonuses from the government, it's not even $7 a month. So we see the difficulties of containing the spread of coronavirus, because people just have to be out in the streets. Let's look at the next one, please. And I'll speak very briefly about the situation of health security. And as Moises was saying, we are coming into facing the coronavirus with lack of personnel. Over 50% of physicians in public health, over 30% of nurses in public health have left the country. If one looks at the Global Health Security Index, Venezuela is among the last 20 countries. It's one of the least prepared in regards to, at the time again of this index, of facing other situations of challenge in regards to health. Let's look at the next one, please. So if one thinks that we have had already 400,000 people with chronic complex health conditions, such as leukemia and Parkinson's and Alzheimer's and others, and HIV, people with organ transplants, plus the 10 million with hypertension and diabetes, the most prevalent in the country without medicines. And now we come into this kind of situation. This is from yesterday. It's an assessment of the state of 10 public hospitals in regards to personal protection equipment. If you look at this, you know, it's like 30% of them without masks, 30% without gloves, without face shields. And this is really important in regards to those who are caring for people with the coronavirus. Running water, 40% do not have running water. And when you look at the ones who have water, and in many cases, it's only because they have trucks being sent to the hospitals. No soap, no disinfectant. So these are the conditions in which physicians, nurses, and other health personnel are facing the pandemic. So far, and this is also until yesterday, 163 deaths among health personnel. The majority of them are physicians and the nurses and other health personnel. And they represent, with official numbers of deaths, 33% of those who have passed away due to COVID-19. Next one, please. So this is the an assessment. This is the projected cases by the Academy on Physics, Mathematics, and Natural Sciences. They had projected already 3 months back that we would be at around between 1,000 and 4,000 cases nowadays. If you look at the bars at the bottom, the gray ones, these are the official numbers. But these numbers are based only on PCR testing. They have 8 to 18 days of delay, and the Academy thinks that we are now, due to their studies, that we're around 4,000 cases per day. So this shows that the situation is much, much worse. They think that instead of 10 deaths per day, we are up to between 140 and 210, sorry. So again, they project, you know, these two scenarios. One hopefully will be the one that we'll be seeing, that sort of stabilization at around 4,000 cases, but we may go up to 14,000 cases per day. Next one, please. And with this one, I will be finishing. It's what is happening with the humanitarian response plan and resources for it. Next one, please. This comes from the financial tracking system of OCHA. And if you look at the amounts required, the $762 million, we have only received so far 8.1%. If we add up what has come out of the humanitarian response plan, it's still even less than what we got last year, which was 180 million. If you look at the countries on the right, Yemen, Yemen, the Democratic Republic of the Congo, Afghanistan, and Syria, the cases with which we are compared in regards to the crisis, you'll see that at least, first, the numbers are much larger, and that there have been resources allocated to them at least, over 20%, 30 or 40%. So I think that this presents definitely a very challenging and difficult situation for Venezuela, which we hope we will be discussing. Moises, this was my last slide. Thank you.
Thank you, Feliciano. That was great. Thank you so much. The slides were perfect. Susana, I see that you joined. Thank you so much for taking the time and joining. And I'm so grateful that the internet, you were able to fix the internet connection. Are you there?
I'm here. Yeah, I'm here.
Awesome. Great to have you. Thank you for making this happen. We did already introduce you as a reminder. She's a senior humanitarian advisor for Caritas Venezuela, one of the most important NGOs who is working on the humanitarian response in the country. And she has a great background here. Here you can see her full background. Susana, thank you. Do you have a slide to show as well? I understand?
Yes, I do.
Okay, Claudia, let's do that. And then the floor is yours, Susana.
I think that I need Claudia to allow me to start sharing the screen.
Oh, okay.
Maybe Feliciano, you should stop sharing your screen. No,
yes.
Is there?
Clifton, can we make Susana able to share her screen? She has a PowerPoint with her.
Yes.
Awesome. Susana, you are now sharing your screen, okay?
Okay, perfect. Yeah. Okay, so first of all, I would like to say that we all in Caritas appreciate a lot having the space among you, also your trust in our opinion, in our information. And also I'm so pleased to share this time with Feliciano. I think that his participation today is a testimony of resilience due to the constraints that he and the Acción Solidaria team has been facing over the last days. So thank you so much to the CSIS, Feliciano, and to all the participants that wanted to be here and share with us our concerns, and also to hear our call to action. My English is a bit frozen. I will try to be clear and to speak slow and share with you some of our slides. So as you mentioned before, we are dealing with a humanitarian emergency, but this is not only as a sanitary crisis. It's not about the pandemic. It's an overlapping of at least 5 threats and risks. So when we thought that the situation was extremely critical, we have seen worsening conditions regarding economic sanctions on top of our humanitarian emergency, then the pandemic, C-19 pandemic, the returnees, and from 2 weeks ago until now is the formal initiation of La Niña phenomenon, which has been affecting our territory with rains and flashlights, and it has been an emergency on top of our regular emergency. So this is not only about a pandemic. It's not about the COVID-19. It's any of these risk or emergencies just is severe enough in any context. So we have all of them together affecting us simultaneously and bringing a lot of damages. So what we have here is, as you mentioned, maybe more than 30% of our population facing humanitarian needs. From the beginning of the work of the international humanitarian system, the population in need has increased at least 70%. So we went from these 7 million people in 2009 to maybe more than 12 million of people facing humanitarian needs in Venezuela. And the target for the humanitarian response and the budget has also increased. The budget for the humanitarian plan is more than 200 times the one for 2019. And as you can see in the map of the WFP, the majority of the regions are affected by the food insecurity, severe food insecurity. And it's not only about food insecurity, it's actually more than that, because it cannot be resolved with food aid. This picture of the food insecurity in Venezuela is the result of a livelihoods destitution over at least 6 years. So it's not a matter of food aid. It's a matter of a total destitution of our base of livelihoods, of our institutions, of our trust, and on our social fabric. So this is the main challenge of a protracted crisis, which is not something that it can be resolved in one day with a huge amount of humanitarian aid. It will take a lot, at least from the nutrition perspective, it will take at least 20 years to overcome the growth retardation and the stunting level that we have now among our children. So this is a very important remark. So as Feliciano was showing, the COVID-19 is also among the humanitarian emergencies. As you can see, is up. Is not declining. Actually, we have, even if we have been enjoying some flexibilization from the government, the transmission is so high, and we haven't seen the peak. But we are afraid that the figures that we used to hear every night on the TV are not actually the cases, are actually the capacity of testing. So if we compare the testing capacity of Venezuela with other Latin American countries, you can see Venezuela as the country with the worst performance in terms of the PCR. So obviously the situation is worse than we can imagine. But the impact of the pandemic is especially on the social and economic results of the mitigation measures. I would like to mention at least 3 of them. First, the GDP, the economic contraction. The Economic Council of the UN, CEPAL, in Latin America is forecasting a drop of down to 9% of the GDP in the region. Venezuela GDP has already dropped by 27% since January, since the beginning of the pandemic. Second, the hyperinflation. We have now, from the previous week, the figures from the central bank, And the inflation has grown at almost 500% since the beginning of the pandemic, and is more than 2,000% of inflation in terms of annual accumulation, annual inflation from 2019. And the estimation of the reduction in the remittances, which has been buffering the poverty and the food insecurity, is that the remittances from the host countries has been decreasing at least a half. 53% of the decrease in the remittances that has been coming from the host country due to the economic impact of the pandemic. So this has been a huge impact. From our own data, and this is regarding child malnutrition, which is a very dramatic picture of our humanitarian emergency. The case load in our outpatient center for caring for malnourished children has dropped from 2,500 children in February to an average of 800 children. And this is because of the restriction of mobility, but also because of the lack of fuel and public transportation. So children are dying at home. It's not that a decrease in the malnutrition, it's that the children are dying at home. So this is a huge decrease, and this is what UNICEF was forecasting for the entire country, for the entire world. And also the international community has forecasted an increase in child wasting by 15%. In Venezuela, child wasting has increased 53%. It's 5 times the forecast of the increment in the child wasting. So from global acute malnutrition on around 8% in February, we have reached 14.6%, which is still quite above the crisis threshold in terms of the humanitarian framework. So this is a huge impact of the pandemic, and it's related to the economic constraint and related to the lack of fuel that we are facing, and also that the nutrition programs in health facility has been stopped and closed because all the attention focused on the control of the pandemic. So just for finishing, regarding our challenges as humanitarian actor, are those of the challenges of any protracted crisis in a fragile state, which are first the weakness of the public institution, the external legitimacy of the state, which is very contested, the state control on our well-being and on the resources, especially for social protection, are extremely constrained. And there is an institutional failure, especially for delivering the social protection scheme from the state. There is a strong parallel Black economy, which is typical of this type of context. Violence, including the activation or the movement of irregular armed groups, deliberate exclusion of sectors of the population for enjoying basic rights. And I would like to include the national NGOs being delivered. There is a deliberate objective of undermining the strength and the capacity of the national civil society for working, not only the humanitarian one, but for the ones working on the 2030 agenda, and also working on human rights, which usually are the same. And finally, the restrictions to the access to the humanitarian space, which includes not only logistical constraints, including lack of fuel, deterioration of basic infrastructure and public services, but also the lack of trust on humanitarian agencies and humanitarian system, the lack of recognition of humanitarian needs, and the presence of irregular armed groups, and also all the bureaucratic constraints and political constraints for getting permission for working, for visas, and for protection in terms of operation, not only of national NGOs, but also for international NGOs.
Yeah.
And from the functional and approaches to the humanitarian work, I would add also the challenges of having the humanitarian system working with a lack of analytical response frameworks relevant to our situation. As I said in the first slide, this is not about food aid. This is not about early assistance. This is not even about early recovery. So we have a humanitarian agenda, especially focused on short-term responses for a long-term issue, and with not much investment in resilience, and also putting a big slide of the plate on the international system instead of focalizing and focusing on national NGO. So our call to action is to keep the humanitarian objectives out of the political agenda. Humanitarian needs from Venezuelan, from those who are suffering, is a reason for insisting in diplomacy. It's not an objective. It's not a condition to be negotiated. It's not a platform for demonstrating a breakdown. Humanitarian objective should be out of these approaches. Humanitarian can wait. Humanitarian needs can wait for a political resolution. We need protection, we need spaces, and we need resources for working now. We need also, and
we have only 30 seconds, Susana, let's wrap up.
Okay, we are calling also for the suspension of the sanctions against Venezuela and other countries as a measure of care for the people. We also are calling for continuing international cooperation and aid to the country, and not to divert it for political purposes. And we would like to invite all the international cooperation to focus on localization, to focus on civil society and local organizations for the humanitarian action, and for flexibility on managing humanitarian budgets and humanitarian framework. That's from this side. Thank you so much.
Thank you, Susana. Thank you. Look, this is devastating. All this data, all these issues are really striking. I believe with approval with the panelists, we're gonna try to post these PowerPoints in our website page. So they're gonna be available hopefully sometime in the next day or so, because there's so much information there that I'm sure the international community and those who are watching can be useful for them. But look, I have a couple, if not 3 questions I would like to ask both panelists before we open it up from Q&A from the audience. And that said, feel free to post any questions on the chat, on the Q&A chat, that my team will forward those questions to me. We'll try to make that work by 10:45, which is the deadline for this event. Feliciano, look, we have many issues to cover. I think there are a couple who are important for us to understand better. One is this issue of sanctions that Susana has mentioned. I mean, she's calling the international community to suspend sanctions. But as you know, sanction has been a tool, a very important tool to limit the Maduro regime, to continue stealing money from the Venezuelan people, increase pressure on Maduro so there can be some leverage for a political transition in the future. Obviously, that hasn't worked yet. We still see Maduro in power, but that says sanctions still a very important policy tool that the international community has on the table to increase pressure and again, trying to safeguard the money of the Venezuelan people. That said, how is sanctions affecting your humanitarian work? I want you to be more specific, both Feliciano and Susana. If you can spend a minute and a half each on that question, I will appreciate it. And I will just shoot you the second question so you both start thinking about it. Is this issue of the lack of humanitarian assistance or the humanitarian assistance gap that we see in Venezuela when you compare Venezuela to other countries in conflict like Syria or South Sudan and Myanmar. As you pointed out, Feliciano, in your PowerPoint, Venezuela received far less assistance and the budgets are just not enough. But still we see a huge gap when you see other countries' assistance. So why do you think that? And why is it important to reduce that gap, to shed light on that issue that is so important for NGOs like yours, but also others who are working on the humanitarian space? Last question, I'm sorry, but it's related to, what are the steps that your organization has taken to try and work around the systemic roadblocks that the Maduro regime has put into place with respect to addressing the humanitarian crisis? Susana mentioned, Feliciano, that Acción Solidaria was just one of the targets when it comes to, political repercussion or others. So let's shed light on that, how difficult it is for you to operate in this very difficult environment in Venezuela. So you got 3 questions. Again, we only have about 6 minutes, so let's try to be on point, quick, to turn to the audience questions as well. Back to you, Feliciano, and then Susana.
Thank you, Moises. In regards to sanctions, their purpose from the very beginning was to sit both parties in the political conflict on the table. So in that regard, individual sanctions, we always felt that was the right course. When we saw more sectorial and general sanctions, we felt that this was something that was going to hurt the country, hurt the population, and will not convey, to that sitting at the table. And the indictments were part of that, unfortunately, when we saw that. And we have been calling very recently for the continuation of the sanctions on the swaps of oil for diesel. Diesel is what moves humanitarian cargo in the country. It's what moves livestock. It's what moves, the needs of people to also use public transportation. So we do oppose any kind of measure that would affect the population at large. And of course, our own programs are affected. There's absolutely no way to escape from that, from higher costs in transportation of donations from abroad to us here in Venezuela, or to move them around here. So that's one thing.
Let me dig deeper on that, Feliciano. That's important. You're saying that. The Treasury Department has this delicate architecture of licenses that, they are targeting sanctions on individuals or companies who are engaging the Maduro regime, but they're providing, in theory, license to NGOs or other actors in the humanitarian space. So are those licenses working? How do you comply with, have you tried to comply with those? Have you applied for license? How is that working on your side?
It's a long process, Moises, and when we talk to some people in the banking sector in Florida, because it's where most of us, do our, say, accounts in the US and so on, or even funding from projects, what they said was that it took from 18 to 24 months to get a license. So, how would you go around perhaps getting that, also with all the, of course, due diligence mechanisms that you have to have in place? So that's one issue. In regards to the political, to the gaps, sorry, it's the very difficult political situation. So we do need good faith political talks. We do need the support of the international community, plus whatever happens here. But we have to be recognizant of, again, that the humanitarian field will be affected by the political conflict, and there has to be flexible, creative thinking and multilateral work in our thinking in order to be able to try to move both tracks forward, let's say, but to insist on having the humanitarian move as fast as is necessary with the resources necessary, because there are millions of people suffering. And in regards to how to, overcome obstacles on the ground, as you said, we were raided last week. We had 8 members of our staff arbitrarily arrested, but we solved it, I would say, very quickly. One thing that was absolutely vital was the reaction of civil society, institutions, individuals, and even beneficiaries of our program that was absolutely immediate, nationally and internationally. And then that brought institutions to work. We had a positive meeting with the Minister of Foreign Affairs recently, because the ministry is the organ of the state that deals with the humanitarian system. So we had a talk with them, and one of our issues was the protection of humanitarian actors on the ground. So, fortunately, in this situation, these mechanisms, institutional mechanisms, worked. Thank you.
Great, thank you, Feliciano. Susana, we have 2 minutes with you before we ask one question from the audience.
Okay, sure. Regarding sanctions, I think we all know that the economic downturn and the destitution of Venezuelan food system and health system started quite before the imposition of sanctions. But we are also clear that the worsening in our humanitarian situation it started to increase after the sanctions, because we all are affected by this. So sanctions extension from personal sanctions to third parties are making difficult, not only for the government, but also for the private sector, for the humanitarian agencies, and for all of us to get access to fuel, to buy and sell issues, to import basic goods, to import spare parts for industry, and to maintain the basic services, the provision of basic services. So, and also I would like to address the issue on the over-compliance in the international financial sector, which is a direct consequence of the sanctions. So this type of over-complying is making more difficult for us operations, including the ability of humanitarian agencies for managing bank accounts and credit cards and all of this. So for us, it's clear that this has worsened our situation, but also are making risky alliances stronger. Yes. From the side of the government. Your second question on why the gap on the financial issues, on the humanitarian gaps, on budget for humanitarian, I think that there are three main causes. First is the lack of trust. I mean, we cannot hide the corruption is all over, even from the government. The information on corruption is huge, and the amount of the illegal economies in the country. So this is a big issue. The second one is the human rights violations. So it's not the same to send humanitarian aid to Haiti or to Costa Rica after an earthquake. That's, to send humanitarian aid to a context and to a government which such a record of humanitarian of human rights violation. And the third one is the reputation. There is a huge reputation that in Venezuela we do not have the capacity to do humanitarian work. And yes, we do. Actually, we have been doing humanitarian work since 2014. The international humanitarian system started just 1 year ago. So I think that at least for the third one, we have been demonstrating that yes, we can do humanitarian aid, and we can do humanitarian aid, work with accountability and with transparency. And final, I think that for Caritas, there has been three main
briefly, Susana, 20 seconds.
Sure, yeah, which are first, you know, gather information for doing a humanitarian planning based on the reality, and also for having elements for advocacy. Second one, just to focus our action in women and children, which is a big issue. You know, to focus our humanitarian aid in women and children and infants especially. And the third one is keeping coordination with all the political actors, including the government, including political parties, including international communities, and keeping all that coordination from total respect of humanitarian principles, especially neutrality.
Right, thank you both. Look, the timing's almost up, over actually, but I don't want to close this event without getting a question at least from the audience as promised. So I have one question, which is, I mean, you mentioned, Susana, that, you know, remittances have decreased half since the pandemic started, given the COVID-19 impact in these hosting countries, right? Like Colombia, Ecuador, and others. Many Venezuelans have lost their jobs, so they're not being able to send money back to their families anymore. But more broadly, Liliana Rodriguez is asking, what role can the Venezuelan diaspora play in alleviating this food crisis and the humanitarian crisis in the country? And again, I want to insist, we have only 1 minute each, and then we wrap up. Feliciano, let's start with you, and Susana, we conclude with you. I think you're muted, Feliciano.
Sorry, yes. I think that, you know, so far, what we have been able to achieve with our humanitarian program has relied very, very heavily on support from the Venezuelan diaspora, basically in 3 countries in Europe: France, Italy, and Spain, as well as in some in Canada and the US. I think it is important to continue on with this kind of support. As well, we have had some of the international humanitarian organizations provide, at least in the areas of health and food. And we hope that this continues on. And as Susana was saying, with our capacities, with our possibilities, with the commitment of our people here on the ground, of us here on the ground, you know, so that this is not sort of in competition or with the UN system, but we do need this kind of support that goes directly, or that comes directly to us as independent, autonomous organizations. We work based on the principles, but we certainly have the capacity to move forward with our humanitarian programs.
Awesome, thank you. Susana, briefly.
Yeah, just, well, 3 main, well, first, Liliana, greetings from here. Well, first is, of course, remittances, but it's more than that. We need from our Venezuelans outside, you know, to keep the visibility high, to get in touch with good sources of information for doing robust analytical work outside and to contribute to the visibility, and also supporting, you know, from our emotional side is to keep the bonds, to keep the bounding relations with us, and keeping trust than we are performing here.
Thank you, Susan. I think that's a great point. We have 5 million ambassadors around the globe. So those ambassadors need to raise their voice and help whatever, however they can. Hey, I want to thank Feliciano and Susana again for joining this panel. I know it's not easy and to join from the ground, but I appreciate your insights, your important discussion today. You raised a lot of important data and questions about policy issues. So we appreciate that. And we appreciate also all of you guys who joined today. I want to thank Jacob Kurtzers and his team and the Humanitarian Agenda for co-hosting this event. I'm really grateful. And yeah, as I said, this event will be recorded, will be posted, and the PowerPoint hopefully will be available on the web page in 24 hours or so for all of you to use. And I see a lot of activity on the chat. I appreciate all of you who have joined this event and comment on the questions and asking questions. So I appreciate that. I will see you next time all, and thank you again. Have a great rest of the day. Bye-bye.
Thank you.